So it is now Thursday. As you can see, I stopped wearing the jaw bra mostly because it became unbearable and we didn't see anywhere in the paperwork that says I should keep wearing it. Just a couple things I wanted to talk about was the surgery prep. That was, it was interesting. What they did is they walked me down this hallway and they handed me this little goodie basket and they said, here's a toothbrush and toothpaste, go brush your teeth. So I brushed my teeth, and then I went to then I walked out of the bathroom and they're like, okay, come this way. I'm like, would you like a blanket? Sure, I'd like a blanket, you know, who wouldn't like a blanket? So they give me the blanket, and then I sit down in this big chair, it looks like a dentist chair, and they're like, okay, straighten out your arm, and they take out this big ass needle. And they stick the needle in, you can kind of see there's a little bit of bruise right there where the needle went in. I'm not scared of needles, you might be, so watch out. Next thing is, they take a little blood sample, and then they start asking you questions. They're like, I don't even remember the questions because it was kind of like, for example, so are you scared? I'm a little scared. And then everything just kind of started like fade away, like like when you're aware that you're falling asleep, which is the best feeling ever. And so then everything was just kind of getting blurry. And then the next thing I remember is I'm awake and I'm like, huh. And then I feel my iPhone in my pocket. I'm like, wait a second, and I'm thinking I should describe how I'm feeling right now. So I take my phone out, and then I go, and you can't understand a word I'm saying. And that was that video. I'm sure if you've seen it already, then yeah. But now on to the doctor that helped me. The doctor's name was Dr. George Marinon. Best doctor ever. When I first met him, he sat me down and he went through the surgery kind of like the only way I was able to describe the surgery to you is because he sat down and he described it to me. And then the night before the surgery, he calls me and he says, hey, it's Dr. George Marinon. I'm calling to see if you have any questions about the surgery or any concerns. And I was dumbfounded. I was like, really? You're calling me personally to ask me if there's any concerns about my surgery? So I asked him, will I be completely put to sleep or will I be kind of knocked out or I'll be kind of aware of what's going on? He's like, no, you're going to be completely asleep. You're going to pass out and wake up and it'll be over. That's pretty much how it was. I was like, they put this needle in my arm, I faded away, and then I woke up and I'm like, okay, so when we getting this stitch started? And like, it was over. I'm like, what? It's over? So, yes, and then after the surgery, I go home and maybe 5 or 6 hours later, I'm like recovering in my bed. I get another phone call from him. I answer and he's like, oh, hey, I'm just seeing, how's it going? How are you feeling? I'm like, wow, this guy is great. Not only does he call me before the surgery, he calls me after it to see how I'm doing. This doctor is amazing. He obviously knows what he's doing. The only discomfort that I have is, stuff that comes with getting surgery. There's nothing that, was wrong. He did everything perfect. It was just fantastic. And another thing I want to correct that I said, I think it was either yesterday or the day before yesterday, that the reason why the rinse hurt so much is because it's cleaning out a lot of dirt. It's because the reason why it hurt so much is my mother clarified this. Mom. The rinse has an alcohol percentage of 11.6, and rinsing out. And is it when you get scrapes on your arm and then they take that alcohol stuff and they dab it and it's burns like crazy. Imagine having holes inside your mouth that where they gouged out teeth, and then taking 3 times that percentage of alcohol and just swishing it around your mouth for 30 seconds. Yeah, that's kind of the pain that I was talking about. But other than that, today, I stopped wearing the jaw bra. My hair looks a little bit better. I still need to get a haircut. I can't shave because if I shave, it'll hurt, right around here. Pretty much same as yesterday in terms of pain. Not any worse, not any better. Maybe a little bit better. I feel really swollen in the back of my jaw, and still can only eat liquefied foods and Jello. That's Thursday, and I'll see you tomorrow.